So from community healthcare perspective, understanding injury pyramid is very, very important. And if you are a healthcare management professional, it is very, very important to understand the intensity of injury that happens from various mechanism of injury. Various mechanism of injury could be road traffic accident, it could be fall from height, it could be blunt injuries from any weapon. So mechanism could be anything, but the intensity of the injury is very, very important to understand. So we'll be using a tool called injury pyramid to understand that. And also we'll understand little bit management perspective of uh, how those injury can be addressed in a community setup. Now, if we want to understand the concept of injury pyramid says that in a given situation or in a given period, if we take all the injuries that happen in a given period of time, then what is the outcome of those injuries? Then, if we put them together into some perspective, then we may find there are majority of cases which are minor in nature. That means those injuries are not very, very critical. First aid or some kind of fast responders can manage those things without much difficulty. And many of the cases are managed on the accident site itself. And some cases they may encounter an emergency department in a hospital setup, but they do not require any hospitalization. So they injuries, most of the injuries in a given situation, in a given context, are fall under this category, what we call as the minor injuries. Then in that category, second uh, is the severely injured, which require hospitalization. So these are another category, and one ended up with death. So these are the three major categories which uh, may happen out of any mechanism of injury. Now, while studying all these things, it was conceptualized in 1931 by H.W. Henrik when he was studying the accidents and its severity. And he found that one severe injury in every 29 minor injuries. So when we study the injury data in a given period of time, that shows, as per H.W. Henrik, that 29 minor injuries happen and one severe injury happen. And if we understand the same data and same evidence in Indian scenario, various studies has been done in Indian uh, accident and injury. Those data show that one death in every 20 severe injury and 50 minor injuries. Now, if those things we'll have to understand a little bit more detail, that shows out of total injury happens, 50 in number, they are minor injuries, which translates to around 70% of the total injuries fall under the category of minor injury, and 28% of the total injury they fall under the severely category, or the severe injuries which require hospitalization, and 1.4% cases of injury they ended up with death. Now, since this is a management technique, and if we want to study the variation among different geography, the variation among different timing, then this injury pyramid can give us that context that how we want to interpret those injury data. For example, if we have instead of 1.4% deaths in a given period, if this data shows this is 0.5%, that means all the accidents are happening, not resulting in deaths. Similarly, we can just look to all the data in terms of percentage, and that can give us the understanding if a particular geography needs specific intervention in terms of reduction of the accidents or severity of the accidents. So, as a thumb rule, if the bottom of the pyramid will be high in number, in a sense that is good because they do not require hospitalization, they do not have much severity in nature, and the least on the top of the pyramid is also considered to be good because most of the accidents which are resulting in injuries are not fatal in nature. So, any period of data we can study, any geography data we can study and put them into this injury pyramid, which will give us that basic understanding about the death, severe injury, and minor injury, or overall the nature of injury in that particular geography or in that particular time period. So, overall, this injury pyramid is a good technique for the uh, healthcare management professionals to know if they want to reduce the severity of accidents or severity of injury in a community setup. Now, going further, once those mechanism of injuries are happening, which resulted either in minor injury, severe injury, or death, then one of the major intervention comes how we'll be handling those cases because each injury case requires some kind of action and some kind of intervention. So when it comes to injury management, we need two major components very carefully. Number one is that selection of appropriate hospital where those patients can be taken care of. And second is that maintaining the golden hour for those victims. Now, golden hour is a commonly used term in emergency management system. Golden hour shows from the time of happening of that incidence where injury is the result until the patient is in the hospital. So this 1 year, 1 hour period is considered to be very critical. And if appropriate care, appropriate intervention is provided to the patient during this 1 hour of time, the probability of survival increases manyfold for the patient if the patient is severely injured. Now, how do we understand or how do we manage by taking these two components, which is appropriate hospital and maintenance of golden hour? If we look to the appropriateness of the hospital, it can be further categorized as two categories. It is appropriate hospital for that particular kind of injury, or the hospital is inappropriate for treating that particular kind of injury. For example, if uh, there is an accident and there is a head injury, and for head injury, we need a CT scan to be done. We need one neurophysician to be available to evaluate those level of injury and severity. And if we are selecting one hospital where there is no facility of CT scan and the neurophysician is not available, that hospital may be considered as inappropriate for treating an emergency which is related to head injury. So that's how we'll have to define appropriate and inappropriate. Then, if you look to the golden hour maintenance, it could be some of the cases are managed within the golden hour time, and some of the cases are managed beyond the golden hour period. So these are four quadrants based on 2 by 2 matrix, two from appropriateness of the hospital and two from the golden hour maintenance concept. we have now got four quadrants. If we just want to look into the quadrant, for example, the very first quadrant is the appropriate hospital and all the cases managed within that golden hour. So this is our category one, and this defines the most desired EMS system that could ever be. If all the injury cases are managed within this quadrant, that means they are going to appropriate hospital based on the type of injury, and all the cases are managed within that golden hour period. They hit to the hospital before 1 hour of that incident that has happened. So if we are having all the patients in this bucket, then we should feel our system as the most effective and efficient system for that matter. Then, if the patients are being transported to appropriate hospital, but they are not maintaining the golden hour, they are going little beyond the golden hour. Here, what happens? The probability of survival declines little bit, but still it is at the best place where the right treatment can be initiated. From that perspective, it is a desired situation. Considering if there is a traffic problem, there is a difficult terrain in any country like India, still this considered to be better situation as compared to other conditions where uh, hospital may not be appropriate or some facilities may not be available in the hospital. Then considering to the third category is that the golden hour is maintained, but the patient is being transported to an inappropriate hospital. So this is not very desired situation as far as the patient stability is concerned. But what will happen that if golden hour is maintained, at least that healthcare organization where the patient has been transported can provide little bit support to stabilize the patient before the patient can move to a better facility for further intervention. Still, it is as compared to category 2, this is not desired uh, because patient is in emergency, and if the patient is severely injured, transporting the patient from one location to another location with certain kind of halt in between may not uh, be proving a positive outcome as far as the patient survival is concerned. Now the fourth category, which is neither maintaining the golden hour nor it goes to appropriate hospital, then this is the absolutely a big no in EMS system of any country or any region. So while we estimate or we want to evaluate a particular EMS system's performance or a particular EMS system's efficiency, what we need to do, we pick up all the emergency cases or all the injury cases that has been managed in a given period of time and put them into these four quadrants. And these four quadrants will tell us the story about the efficiency in managing the patients in that particular time period. So if we are having better percentage of cases in category 1, we'll assume that this EMS system is good. If we have more number of cases in category 4, we consider this system needs a huge improvement. Now the strategies to be adapted here. So we have to do this 2 by 2 matrix for evaluation and estimation of total cases that has been presented to that particular EMS system for its management. Then second one is that we have to utilize WHO categorization of emergencies and hospitals to be used to define the hospital categories. And WHO has given a very structured approach in categorization of emergencies like level 1, 2, 3, 4. So also for the categorization of healthcare organizations, that is including hospitals, level 1, level 2, and level 3 hospitals. So based on that, we can have a kind of tally that which kind of emergencies or injury cases can go to which level of hospitals. Then third one is that data to be evaluated for the growth in category 1. That means if we have certain cases in category 2 and 3, we'll be trying to push them to category 1. If golden hour is not maintained, we'll be trying to build some new infrastructure in terms of adding new ambulances, or maybe adding a few more strategies so that cases from category 2 can be pushed to category 1. So also cases from category 3 can be pushed to category 1. So this is in a nutshell very, very crisp and easy to do management techniques and tools to understand the injury, the severity resulted from injury through injury pyramid, and finally putting those injury related emergencies into four quadrants to understand how the current situation is being managed and how better it can be managed going further. So thank you so much for your patient hearing, and I'm sure you have understood quite a lot of things out of that, and we'll be meeting you in our next session. Thank you so much.